instead of not doing any physio, definitely Kneesy online platform will help to have a rehab in case of ACL injuries, post ACL reconstruction.
Robotic knee surgery sounds very advanced. In simple terms, what does robotic knee surgery actually mean?
Yeah. So to start with, I'll start with knee replacement. What is knee replacement? Knee replacement is not such that the entire knee is replaced or the entire bone is replaced with your implant. You need to walk, you need to do some kind of exercise which is not possible after knee pain.
Okay.
So knee health is directly related to life. Whenever there is a knee pain, the associated diseases like heart disease, diabetes, obesity, inactive lifestyle which follows. So that's why I give much importance to knee, and that's why knee joint is the most important joint, I would say, in case of health, in case of fitness.
We often hear people say knee pain is just a part of aging.
Yeah.
So is knee pain really normal, or is it just something people ignore?
So knee is not given importance. Whenever there is a chest pain, the patient runs to a doctor. So, but if it's a knee pain, they try medicine themselves. They try some kind of Ayurveda or some kind of things. Those are not wrong, but I think correct diagnosis, consulting an orthopedician, knowing the stage of arthritis, and then having a treatment according to the stage is important. So it is simply ignored for now. But whenever there is a pain in such an extent that patient is not able to walk, at that stage they seek the treatment. But at that stage it's already in stage 3 or 4. Then the conservative part of management is not possible. So again I said it should not be ignored. It should be addressed as equal as any other pain in the body. So knee arthritis should not be ignored. Stage 1 and 2, how we diagnose it with X-ray. When there is a joint space left on X-ray, we say that there is some cartilage, some meniscus left. Originality of the knee joint is preserved. At that stage, it is called as early arthritis. So early arthritis can be managed with lifestyle modifications like weight reduction, good physiotherapy, good rehab, diet modifications, diet which helps cartilage regrow. It's like vitamin C rich diet, calcium rich diet. Also cartilage is made up of protein, so protein rich diet. This all diet helps in knee health. This technique, robotic technique, helps in giving better results to the patient. The implant placement, the angle of implant, as I said, the slope of tibia, the balancing, how the deformed knees are corrected, how the deformed knee is made straight, how accurately it is made is what robot gives us better.
ACL injuries are becoming very common even in non-athletes nowadays.
Yeah.
So how does the ACL become so vulnerable to injuries?
Lubrication always helps. It reduces pain further. So intra-articular injection of lubrication also is what I prefer in early stages. But in case of late stages, stage 3 and 4 of arthritis, these things don't work. Those are just a waste of money, and those are of no use in late stage of arthritis. So in early stage, I feel it's still okay.
So how does online rehabilitation, a platform like Kneesy, have a role in knee health?
So as I said, compliance is very important. It is not possible for every patient to have one-to-one physio. It may be a physio's problem, so physio can't reach to him, or it can be patient's problem. Patient can't reach to a physio center, or he must be quite busy to he can't afford a traveling time.
Hello everyone, my name is Swara Desai, Rehab Program Head at Kneesy Health. Today, this conversation is to explain everyone about the clear and precise way of knee health. We have Dr. Pranit Sonawane, Robotic Joint Replacement Surgeon at KIMS Manavta Hospital, Nashik, who is also a partner and surgery head at Kneesy Health. Welcome, Dr. Pranit.
Thank you very much, Swara.
Okay, so Dr. Sonawane, we often hear people say knee pain is just a part of aging.
Yeah.
So is knee pain really normal, or is it just something people ignore?
I would say recent time it's been ignored quite oftenly, because I always say it's not just a knee pain. It's affecting your walking, it's affecting your mobility, and eventually, as we know, for your healthy heart, your healthy lungs, you need to walk, you need to do some kind of exercise which is not possible after knee pain.
Okay.
So knee health is directly related to life. Whenever there is a knee pain, the associated diseases like heart disease, diabetes, obesity, inactive lifestyle which follows. So that's why I give much importance to knee, and that's why knee joint is the most important joint, I would say, in case of health, in case of fitness.
Okay, that was a great answer. So, what actually happens inside the knee during arthritis?
Yeah. So arthritis is nothing but damage of the knee cartilage. So knee is made up of femur distal end and tibia proximal end. Both surfaces are covered with a smooth cartilage, which is always regenerated when we are young. But as the age progresses, the regeneration process is quite slow. That's why the cartilage gets worn off, and then there is no smooth surface to articulate with. So what happens is the femur part and the tibia part brush against each other, which causes some kind of sound, crackling sound, stiffness, and that causes knee pain. That is nothing but arthritis. So arthritis are of two types. One is autoimmune, which is rheumatoid arthritis, which is seen in a young age, maybe 30, 35, but it affects multiple joints. Osteoarthritis is a thing which affects after the age of, say, 55, and which is age related.
Okay. Many people live with knee pain for years before they go to see a doctor or seek treatment. Why do patients delay getting their knees treated?
So I think most common, as we discuss, it's ignorance. So knee is not given importance. Whenever there is a chest pain, the patient runs to a doctor. So, but if it's a knee pain, they try medicine themselves. They try some kind of Ayurveda or some kind of things. Those are not wrong, but I think correct diagnosis, consulting an orthopedician, knowing the stage of arthritis, and then having a treatment according to the stage is important. So it is simply ignored for now. But whenever there is a pain in such an extent that patient is not able to walk, at that stage they seek the treatment. But at that stage it's already in stage 3 or 4. Then the conservative part of management is not possible. So again, I said it should not be ignored. It should be addressed as equal as any other pain in the body. So knee arthritis should not be ignored.
So, like you're saying, it should not be ignored. So, are there any signs which people should not miss?
Yeah. So arthritis generally, early signs of arthritis are like pain. The pain can be only during walking, or some patient experience it in early morning when there is lack of exercise. The knees are being in one position for a longer period of time. So early morning stiffness is other thing. There is lack of movement. The patient is not able to move the knee completely, not able to flex the knee. There is clicking sound, pain during getting up from chairs, getting up from the ground are the typical signs which are classical of arthritis.
When someone is diagnosed with arthritis, maybe in the initial stages, grade 1, grade 2.
Yeah.
So, what are the treatment options which generally exist before surgery comes into picture?
Yeah, so very good question. So stage 1 and 2, how we diagnose is with X-ray. When there is a joint space left on X-ray, we say that there is some cartilage, some meniscus left. Originality of the knee joint is preserved. At that stage, it is called as early arthritis. So early arthritis can be managed with lifestyle modifications like weight reduction, good physiotherapy, good rehab, diet modifications, diet which helps cartilage regrow. It's like vitamin C rich diet, calcium rich diet. Also cartilage is made up of protein, so protein rich diet. This all diet helps in knee health. And stage 2 can also be managed with some medicine which are safe for kidney and liver, but it comes with a very limited period. No medicine should be taken more than 10 to 15 days, which can affect your kidneys, which can affect your liver. So early arthritis can be treated with good lifestyle modification and some medications and physiotherapy as well. And I would say very important part comes is in lifestyle modification is nullifying the ground reaction force. So what that means is, so you should always prefer using a memory foam footwear in-house, in offices. Majority of time we are indoors. We are working, we are in-house. So using a memory foam footwear in-house is important. And also while training, whatever sports you play or whatever recreational activity we do, at that time also a good quality sports shoes with memory foam which absorb the ground reaction from your knee is important to preserve knee health in early stages.
Okay. At what point does the treatment shift from medicines and physiotherapy to needing surgery?
Yeah. So stage 3 and 4 arthritis are the one which are not, cannot be treated with medicine or physiotherapy. So how to diagnose it clinically? Clinically, it's diagnosed like a patient has already taken medications for more than 15 days, more than 1 month. The knee pain is not reducing. A patient has already taken physiotherapy as well. Lifestyle modification is done. Everything is done. But the knee pain is affecting to such that their daily activity is reduced. They are not able to walk for their health. They are not able to do morning walks, evening walks, their recreational activities. Then these are the clinical signs which say your knees are in a late stage of arthritis, which is 3 and 4. On a OPD basis, how I diagnose, it's when I do a weight-bearing X-ray and it shows that there is no joint space left. There is the femur part and the tibia part are touching each other. Then that is a stage when I don't advise medicine. If I advise medicine, it's not going to work. It's just going to relieve pain for some time, but that medications will not reform or regrow the meniscus part or the cartilage part. That medicine will only affect kidneys and liver. And I always say that replacing a joint gives you good result, but replacing a kidney is not that promising, or replacing a liver is not that promising. So I always advise my patient that don't take any kind of medication more than 15 to 20 days, and don't hesitate to choose a surgical option for late stage arthritis, which has got a promising result and life-changing results as well.
Okay. So patients often ask, how do I know when surgery is really needed?
Yeah.
So what factors do you take into consideration before recommending it to them?
As I said, late stage arthritis, patient has already taken treatment, and clinically if the patient is showing significant bowing of legs, deformity of legs, that are the signs which bowing of legs cannot be corrected with physio or with medications. That kind of arthritis needs surgery. So that kind of patient, I always advise the surgery.
Okay. So now let's talk a little bit about the two techniques. We have manual total knee replacement and we have robotic. So robotic knee surgery sounds very advanced. In simple terms, what does robotic knee surgery actually mean?
Yeah. So to start with, I will start with knee replacement. What is knee replacement? Knee replacement is not such that the entire knee is replaced or the entire bone is replaced with your implant. Knee replacement simple means the layer which is forming the joint, the distal part of femur, the proximal part of tibia, which is a cartilage naturally. That cartilage has worn off completely now. There is no cartilage left. There is no meniscus left. So there is, as I said, there are no medications. We can regrow that. So only that damaged part is replaced with a cobalt chromium layer up, cobalt chromium layer below, and a highly cross-linked polyethylene insert in between. So these three parts are changed. And majority of the bone part, majority of the ligament part, majority of the muscle part is kept natural. So 90% of knee is natural. Only 10% damaged part is replaced, which is nothing but knee replacement, to be frank. So now conventionally from years we are doing it manually. So removing the damaged part with hands, with a surgeon's skilled hand, with a saw is what we say a manual surgery. It also gives excellent result if the patient, if the surgeon is experienced and patient undergo a good rehab. Recently, from last 3 years, I'm doing robotic surgery as well. So what is robotic surgery? It is nothing but a robotic arm with an accuracy removes the damaged part as instructed by the surgeon. What benefit it give is that human eye or human judgment can judge up to say 3 mm, 4 mm accuracy. Robot gives us sub-minimal accuracy, that is the part less than 1 mm which need to be removed or need to be kept is sensed by the robot. So sub-minimal accuracy is what we get with the robot. So this accuracy, this technique, robotic technique helps in giving better results to the patient. The implant placement, the angle of implant, as I said, the slope of tibia, the balancing, how the deformed knees are corrected, how the deformed knee is made straight, how accurately it is made is what robot gives us better, in a better way. And there is a continuous feedback. What it is doing, we are able to see on screen. It's not just eyeballing, it's not just a manual judgment. So that benefit we get with the robotic surgery. And second benefit is that instead of saw, there is a miller part. So that miller also has a continuous irrigation with a saline. So that's why there is no heat generation during cutting. So that part takes care of the post-operative pain as well. So in manual surgery, I may need 4 to 5 days of painkiller to give to the patient. But in robotic surgery, post-operative pain is significantly reduced. The knee function is attained earlier, less requirement of physio, and patient is able to go back to the normal activities soon. So the rehab part is taken care with a time benefit, which we get. It is early by around 15 days or so.
Okay. So many people have this common belief that in a robotic surgery, the robot does the whole surgery. So what role as a surgeon do you have to play over there?
Yeah. So robot is nothing but a computer. In computer, it's always input, processing and output. So similarly, a surgeon has to instruct the robot what kind of balancing we want, what kind of knee straightening we want. After CT scan of a patient, that data is taken on a computer. On a computer, I have to sit for 20 minutes extra a day prior of surgery, on which I plan how the implant will be placed, what size of implant, how accurately I will make the knee straight, and then that data is fed by a pen drive to the robot. And that execution is taken part with a robotic arm. So robot is nothing but a surgeon's extra arm, I would say. Robot has no intelligence of doing surgery himself. It's human again, it's a surgeon, but just that instead of a manual saw, I use a robotic arm.
Okay. So from a patient's point of view, how does the robotic surgery change the recovery time for a...
Yeah, definitely. Recovery time is reduced, as I said. Post-operative pain is less, so that the flexion achieved after knee replacement. Indian patient demands cross-leg sitting. So that kind of results are achieved quite early. The recovery is fast. That is a major benefit which I get with a robotic surgery.
Let's talk a little bit about a different injury now, ACL injury. That is the anterior cruciate ligament, most common sports injury which occurs. So ACL injuries are becoming very common even in non-athletes nowadays. So how does the ACL become so vulnerable to injuries?
So ACL injury or ligament injuries comes under sports injury, most common in sports person, as you said. It is generally taken place while twisting of knee. When the foot is stationary and the body rotates is the most common mechanism of that injury. Common in cricketers, common in footballers. But as you said, it is also in non-athletes nowadays. And it is a part of degeneration again. You must have heard the word mucoid degeneration of ACL. Then that is a part of arthritis again. So many times early arthritis is associated with mucoid degeneration of ACL. And if not taken care at the right time, there is a tendency of tear, spontaneous tear of the ACL. The patient present with instability of knee. There is buckling of knee while walking. These are the signs of ACL tear, and it is common in non-athletes as well.
When an MRI shows a complete ACL tear, how often is surgery necessary?
So rather than MRI, I generally give attention to the patient, the clinical symptoms. If he's a sportsman, if he's a active person and he complains of instability of while walking, that there is a giving away of knee. I am not able to walk with the speed I used to walk before the injury. I am not able to play my favorite sports. These are the signs when the surgery is needful. MRI can be sometimes misguiding, can be guiding as well, but then instability is a thing which we need to operate. Then MRI is a supportive thing. If it shows a complete tear, you have to reconstruct the ligament with arthroscopy.
Okay, some people manage well even without a surgery post ACL, while others struggle. So what is the difference between those two?
Generally, the person who managed well without surgery in a ACL tear must be having a partial ACL tear, which recovers spontaneously with good rehab. So if there is a good hamstring strengthening, the muscles which pull the tibia backwards should be strengthened in that case. If that's done in a better way, the symptoms are relieved. There is no buckling after a good rehab of 1 or 2 months with some braces, external braces as well. These kind of persons recover well without surgery. But if it's a complete tear, unlikely the ligament can regrow, or unlikely there is any external muscles which can balance that ligament. So in case of complete, you have to go with arthroscopic ACL reconstruction.
Okay. People often say that I take medications for blood pressure, hypertension, and for diabetes, and they take it lifelong. So, why not the same for knee pain?
Yeah. So, as I said, there are no medications as such which can regrow the cartilage or the meniscus. In case of hypertension or diabetes, there are medications which can control the sugar, which can control the hypertension, but it's not the same case in case of knee. Even if patient takes knee medications for 1 year, 2 year, it will not change the arthritis scenario. The knee pain will keep on increasing. Rather, as I said, the medications will cause damage to kidney and liver, and the knee problem will persist, but there will be extra problem with kidney and liver. So I don't advise any kind of medication more than 20 days or say 1 month or so.
Painkillers and injections like PRP, hyaluronic acid, all these things, they reduce the patient's pain for some period of time. But later the pain anyway comes back. So what do people need to understand about this cycle?
So in case of early arthritis, say grade 1 or 2, I still advise patient these things: the PRP, the hyaluronic acid, HA injections, intra-articular helps in these patients, grade 1 and 2. And then they are relieved of pain. So instead of taking painkillers, PRP, which is created or generated from your own blood, helps to regrow the cartilage to some extent. So heal the cartilage to some extent. So PRP I do advise for arthritis or any other ortho problems. Lubrication always helps. It reduces pain further. So intra-articular injection of lubrication also is what I prefer in early stages. But in case of late stages, stage 3 and 4 of arthritis, these things don't work. Those are just a waste of money, and those are of no use in late stage of arthritis. So in early stage, I feel it's still okay. No problem.
On this World Arthritis Day, what is one important takeaway message you want to give to our listeners?
As I said, don't ignore the knee health, what we started with. It is directly related to your heart health. It is directly related to your lung health, and as a fit human being yourself. So to take care of health, you need to walk, you need to be mobile, you need to have a good BMI, your weight should be in control. To achieve this, you need to have good knees. So take care of knees. In early stages, use good rehab, good safe medications, PRP, HA, whatever, consult your doctor. But in late stages, if it's not working, don't bombard yourself with medications and anything. Don't hesitate to have a knee replacement done if it's stage 3 and 4, because it will change your life. In 1 month of period, you will be able to walk more. In 3 months, my patients have 50 kilometers of daily walking in their pilgrim rallies as well. You must have heard Pandharpur Wari, Narmada Parikrama. These are common in Maharashtra. So those kind of activity, if patient is able to achieve for their entire life, then why not to achieve it? So you can easily get rid of knee pain by knee replacement in stage 3 and 4. You can choose robotic, you can choose manual, doesn't matter, but then you should get it treated.
So how does online rehabilitation, a platform like Kneesy, have a role in knee health?
So as I said, compliance is very important. It is not possible for every patient to have one-to-one physio. It may be a physio's problem, so physio can't reach to him, or it can be patient's problem. Patient can't reach to a physio center, or he must be quite busy he can't afford a traveling time. So instead of not having any physio, online platform like Kneesy will definitely help. It is equally beneficial as you can say a one-to-one session, because there are multiple softwares, multiple ways to take that physio which Kneesy has incorporated, which are active one, not just the formality online platform. So instead of not doing any physio, definitely Kneesy online platform will help to have a rehab in case of ACL injuries, post ACL reconstruction. Maybe if I had a patient who was a player, but he used to live in a remote area of Nasik, say Dindori or so, but it was not possible for him to travel daily. So I had my colleague, I referred him, and he took his online physio, but he did equally well with the other patient who have done actual physiotherapy. So he achieved the range, he achieved the strength. So online physiotherapy is effective, and it will save traveling time, it will of the physio of the patient as well, and it will improve the compliance with the physio.
Great. It was nice talking to you today, Dr. Pranit.
Thank you. Same here, Swara.